Greater trochanteric pain syndrome exercises. Exercise 1. Hip extension stretch. You need to kneel on the floor with your body upright. Gently lean back at the waist until you feel a pull on the front of your thighs. Hold for 30 to 60 seconds. Repeat 3 to 5 times. Briefly rest in between each stretch. Exercise 2. Gluteal stretches. Sitting with your body upright, cross your affected leg over your other leg, placing your foot flat onto the floor. Use your hand to pull your knee across your body. Hold for 30 to 60 seconds. Repeat 3 to 5 times and briefly rest in between each stretch. Gluteal stretch number 2. Lie on your back and bend both knees. Cross one leg over the other so that your foot is resting on the opposite knee. Bring both knees towards your chest and gently pull the uncrossed leg towards you until you start to feel a pull in your buttock. Hold for 30 to 60 seconds. Repeat 3 to 5 times and briefly rest in between each stretch. Gluteal stretch number 3. Lying on your back, bring your knee towards your chest. Pull your knee across your body and up towards your opposite shoulder until you feel a pull in your buttock. Hold this for 30 to 60 seconds. Repeat 3 to 5 times and briefly rest in between each stretch. Exercise 3. The clam. Lie on your side with your pelvis square, hips bent to approximately 45 degrees and knees bent. Tighten your lower stomach muscles and maintain a neutral position of your back throughout the exercise. Keep your heels together and slowly lift the top knee by turning the hip out without letting your back or pelvis twist. Turn out as far as your back and pelvis allow you to, whilst maintaining control and a neutrally aligned back. Hold for 5 seconds. Aim to continue until you begin to tire or your technique declines. Make sure you rest in between each exercise. Exercise 4. Abduction long lever. Lie on your side with your bottom leg bent and your top leg straight, with your top leg slightly bent behind you. Slowly raise the top leg to as high as possible, keeping the knee straight, leading the movement with your heel and not your toes. Maintain a neutral position of your back throughout the exercise. Hold for 5 seconds. Relax down slowly. Aim to continue until you begin to tire or your technique declines. Exercise 5. Bridging. Lie on your back with your knees bent and feet shoulder width apart. Arms can be crossed across your chest or by your sides if you require more support. Tighten your lower stomach muscles by drawing your belly button down towards the spine, but keep breathing. Keeping your back flat, slowly lift your pelvis until your knees, hips and shoulders are in line diagonally. Hold for 15 seconds and then relax down slowly. Aim to continue until you begin to tire or your technique declines. Make sure you rest in between each exercise. You should feel your bottom and stomach muscles working and not your hamstring muscles at the back of your thighs. general advice, continue with your usual activities that you do on a daily basis. Continue using ice and taking your usual pain relief or anti-inflammatories. Or you can visit the hospital's website at www.rjah.nhs.uk for further information.